Hello, my name is Mary Ciccarelli with the Indiana Complex Care Coordination Collaborative at Indiana University School of Medicine. I'm here to offer you some ways to accommodate an abdominal exam for individuals who need special assistance. Individuals with intellectual or developmental disability, often called IDD, may experience anxiety at the doctor related to unfamiliarity with the situation or a past experience of difficult medical encounters. Lack of cooperation may be related to anxiety and can create challenges in examining some patients. First, let's consider how to best communicate. Verify potential differences in receptive and expressive language skills. Acknowledge accompanying caregivers and verify their roles. Key points in communication are: explain and demonstrate, speak and move slowly, use comforting language to praise cooperation, take 5 to 10 second breaks when needed, and re-explain, sometimes with visual cues when needed. Begin with an explanation of the planned exam. Seek consent or assent. If there is hesitancy, demonstrate on a caregiver, a doll, or a stuffed animal, or use a picture. Ask about potential aids, which you may use for either distraction or incentive to ease and complete the exam. For example, you might use a snack, a toy, screen time to help. First, then language might be helpful. For example, first we're going to do the exam, then you can have this sticker. If the person has difficulty, allow for brief 5 to 10 second breaks within the exam to help the person take a deep breath and relax. Help your patient get ready. Consider whether he or she can adjust their clothes or put on a gown. Consider if they need help getting into position on the exam table. Maintain a comforting conversation while you do your exam. Before listening, explain that you will touch the person with your stethoscope and listen in different parts of the belly. Some people might want to help by actually putting their hand on your hand on the stethoscope. It helps them feel a little more in control. Explain that the next step is to touch the belly with your hand. Assist the patient in relaxing if necessary. For example, bend their knees a little bit so that their belly goes soft. Some people might want to use actually hand over hand for this part of the exam as well, again, to feel in a little more control or to not feel ticklish. If you meet with resistance, pause and re-explain. Then make a plan for what might work for that particular patient. Consider using an example, showing the next step on a caregiver, again, a doll or a stuffed animal or a picture. Then ask if you can try again. If the individual allows an attempt, praise their cooperation, offer an incentive, whatever you previously agreed upon. If using the exam table is not feasible, consider how to alter your approach. Some individuals will allow you to sit next to them in a chair, hug them, or stand and dance with them while you're actually listening and palpating. It is generally recommended that clinicians should avoid forcing any part of an exam. If there's an emergency reason for an exam, you might actually have to consider sedation in the person who really can't cooperate. When you've finished your exam, praise your patient for cooperating and offer an incentive that was already agreed upon. After this, discuss your findings and recommendations with the individual and caregiver, use simple language, provide time for them to process and ask any questions. Thank you for watching. To assist your patients in preparing for an abdominal exam, you can refer them to the partner video at 4hourhealth.org. Thank you.